It kind of goes back even before I started working in pain medicine 10 years ago. My actual specialty when I was in graduate school was working with the HIV population, and this is oftentimes a stigmatized group that is oftentimes referred to as being difficult. And so I already had some experience working with a population that was challenged, and when I was offered the position of working in a pain clinic, I noticed that a lot of my experiences and a lot of my history working with the HIV population transferred to working with the pain population. It's not that patients are difficult, is that we're oftentimes rushed, and because of the pressures of our job, aren't able to kind of spend the time that's necessary to work with these populations. And so I really feel like it's one of my goals when I come to any kind of conferences is to educate other providers that it's the time that we invest that actually makes the best results, and just encourage at least someone in the audience to hear that and maybe change their practice. Providers who are saying that they often feel stuck. They don't know what to do. And so that being held hostage idea came from that. And one of the things that I learned when I worked in corrections was FBI training on how to deal with crisis negotiation. And it's really surprising that what they use are communication and psychological strategies, which are things that we could be using as providers with our patients. So it is the perception as providers of the difficult patient, and I think that that's what I can offer is help patients, help providers, improve their communication and improve their listening skills, because that's what's going to help move that relationship forward. I talk to providers all over the country, and what they tell me is that some have had some kind of communication training, but oftentimes this is the first time they're hearing something like this. And so the feedback that I usually get is that it seems like it makes sense and we should be able to kind of figure it out, but we don't. And so having someone come in and kind of underline the importance of communication skills when working with this type of population kind of helps them. Let the patient express themselves first. I know we have our agenda, I know we have our evaluation, I know that we have a short time and period in order to do what we need to do. But the patient has their agenda, and they've been living with this, and they have been thinking about it. And so we as providers, what we can do is respect that time, give them some time to kind of talk about what they've been thinking about, really listen to what they have to say, what their concerns might be, what their fears might be, and then try to address those concerns. They come in and we're pressured for time, and so that doesn't happen. And so we do the best that we can with the little time that we have, and oftentimes that doesn't work. And what might work better is just stopping and just listening to the patient to see what their concerns might be, their misconceptions might be, their fears might be, because you can make a large difference in someone's life just by listening to those things. Absolutely, absolutely. So when working with patients, it's important to tell them how to communicate. What kinds of information do we need in order to do our evaluation? What kinds of messages are not helpful? Why we use the communication that we do? How we communicate with each other? So that way, oftentimes what will happen is a patient will be present and two providers will be talking, and the patient may not be clued into what the discussion's about, but if we provide them the education about what is being communicated, they often can feel more included in that discussion. So absolutely, we need to encourage patients to also be part of that communication training process. So looking into the future, what I hope we as a medical field do is start pushing for the inclusion of other types of treatment that may not be the first line treatment, but may be a good complementary or integrative treatment that can be used to make these people's lives more comfortable. There are multiple different types of treatment, and there's no research to support using one over another, yet when it comes to insurance coverage, that's not necessarily the case. And so kind of underlining that, we need to advocate for insurance companies to cover some of these other treatments, finding back-end ways and as a provider to get some of these resources to patients. So what I would like to see is that system is more streamlined and that patients will have better access to some of the other modalities that maybe aren't covered by insurance or are not available in their community.